let's get started. So thank you everyone for joining us today from literally all over the world. I am Dr. Nova Schiller. I am the veterinary medical advisor at BioGal Labs, and we are the manufacturers of Vacci, which is an in-house titer test for core vaccines in dogs and cats. This webinar is also in collaboration with our great and trusted partners, Eurovets, that they are the distributors of Vacci in the UAE. It is also my great pleasure to welcome our speaker for this evening, Dr. Dorian Gaeta. So Dr. Dorian started his veterinary career working in various countries, dividing his times between charitable organizations and private practice. This culminated in completing a rotating internship at the prestigious Animal Health Trust in the UK. With a solid foundation, he pursued further qualifications in surgery, obtaining his PGC in small animal surgery. The urge to participate in advancement of veterinary science, research, and practice, however, never subsided. And combining his previous experiences, he co-founded the Small Animal Blood Bank Veterinary Clinic and Laboratory in Dubai, where he is the medical director. Now, before I pass it on to Dr. Dorian, there will be at the end of the presentation a short Q&A where he will try to answer as many questions as he can from the audience. If anyone has a question during the presentation, please just write it in the QA box and not in the chat box. And that's it. I'll pass it on to you, Dr. Dorian.
Thank you. Hi, everyone. Thanks for joining us. So I'm going to try and get us all through this as painlessly as possible. But basically today we're going to be talking about Vacci and/or vaccines. Half of the presentation is just going to be to refresh some of our theory about immunology, because let's face it, reading about immunology is not that enjoyable. And I think most of us were just happy to pass that module at university. So we're just going to go through a bit of a refresher course, and then I'll try and link that into actual clinical day-to-day applications of the Vacci check. So obviously the webinar is sponsored by BioGal and Eurovets, but this is not a sales pitch. I'm also not an immunologist. I'm just here to tell you guys what it is we've done since adopting the Vacci check almost, I think, 4 years ago. So we'll take you through that. So starting off, the vaccines, actually very simple concept. People figured out that if you actually got sick and you managed to survive the disease, you were no longer likely to succumb to it. And that simple observation meant that some very, very clever people decided to say, hey, you know what? What if we could do the same without you having to experience the fun of getting sick? So they literally came up, and if you ask me, probably one of the best inventions humans ever came up with was the vaccine. So if you think about that, we are not needed. We could all go home because there should be no more disease. And that is not necessarily untrue, but there are a few caveats. So for example, out of the 5 main pathogen groups, there is a general rule of thumb, which says that vaccines do not work as well for larger pathogens. So that already takes out fungi, protozoas, and parasites. And actually, if you think about it, I think we all remember the Giardia vaccine. We remember the ringworm vaccine. And if you really think about it, where have they gone? They're not really used in clinical practice anymore. So we now kind of very much focus on viruses and bacteria. Now, on top of that, so that already eliminates a few categories. So our job is still safe. There are things that are affected by the person itself or the patient themselves and the technology that goes into the vaccine. Hence, they don't all work the same way, and the patient doesn't respond the same way. So 2 main categories when it comes to vaccines, and this is a very sort of broad distinction, but we're going to put them into 2 groups. So you have something called optimum immunity, which is used interchangeably with sterilizing immunity. I'll get into the details of that a bit later, but they're not exactly the same thing, but are very often used interchangeably. So if you come across that, don't be confused. These are basically vaccines that will prevent the infection and transmission. And then you have the non-sterilizing immunity. So those vaccines basically reduce the severity of the disease, but do not prevent infection and do not prevent shedding. And this gives rise to the chronic carriers. So we see that a lot in our cats, right? So with cat flu, you have cats that are completely healthy and asymptomatic, but are absolutely shedding the viruses. And that also means that you can guess calicium and herpes virus are of the non-sterilizing immunity variety. And then you have distemper, parvo, and panlu, which would be in the optimum immunity variety. Now, we all are dealing with this, especially when it comes to vaccines. Post-COVID and with the appearance of AI, most notably ChatGPT, I'm sure that most of you in practice have people coming to you with either partial information or a lot more information than they used to have years and years ago. That also makes, your vaccine appointment a bit more complicated. That also means that we need to up our game and we need to actually know a lot more about the actual vaccine than we ever have previously. This has also led to an increased mistrust of vaccines. I'm sure you guys are all feeling that. But it also led to people asking more questions and wanting to know what it is exactly they're giving and how it works. And sometimes these are very difficult questions to answer. And there is actually a paper that came out that showed that 53% out of 2,200 people either supported that the idea that vaccines were unsafe, unnecessary, or ineffective. And again, we can all relate, and I'm sure human medicine can also relate to that fact. So, giving you a brief example, in day-to-day, you have tons of different vaccines, right? And one of the common ones we see here is kennel cough. So you have the injectable one. This is a killed vaccine. So the first thing that we need to realize is that because of the fact that it's a killed vaccine, it will need a primer and a booster. It doesn't work as a one-off. The second thing is that you're now giving it parenterally. So you're stimulating your IgG response, i.e. the virus needs to get into your lungs, cause an infection for your immune system to respond, as opposed to your kennel cough, which we spray in the nose, hopefully in the mouth soon to protect all of us. And what that does is it stimulates your mucosal immune system, which is more IgA, and that allows it to be stopped at the entryway. Now, obviously, there's other differences. So, for example, giving it as an injectable has less side effects, because I'm sure you've all seen that giving kennel cough intranasally can cause sneezing or discharge in some patients. But also the onset of immunity is different. So, for example, if you give the kennel cough intranasally, you are waiting for about 3 to 5 days for that to happen, whereas the injectable can take weeks. So these are all small nuances. And unfortunately, when it comes to immunology, details really do matter. And this is something that is easy to implement, and just knowing it can change or affect the decision you make for your patient. Now, when it comes to distemper, for example, there's other types of vaccines. There's a recombinant version, there's a modified live version. There's even, I found a reference to an old measles type, but this is way before my time. Interestingly, that can bypass maternal antibodies, but we'll skip over that. And then you've got your panleukopenic cats, right? So feline parvo. Interestingly, I'm sure you all remember the Feel-O-Vax vaccine, or the PCHR, which is that nifty all-in-one for cats that are trying to kill you. Those are actually killed, versus your Novivac Tricat, which is a modified live. So now you're actually choosing the vaccine not only based on your patient behavior, but you're also choosing it based on how this vaccine will be received in the patient that you're vaccinating. These are just made a GIF because honestly, there is so many vaccines available in the world. So we just made a GIF to represent that. Now, breaking it down. So we had the two categories at the beginning. Okay, so that's just the very broad categories. Now, the actual types of vaccines. There is 3, because a live vaccine doesn't exist, because injecting an animal with the live disease would be borderline insane. So we are left with a killed vaccine. Now, a killed vaccine is basically the pathogen with all the teeth removed and killed. Now, because just injecting your patient with the actual killed pathogen is immunogenically poor, they add something called an adjuvant to stimulate your immune system to respond. Now, live attenuated, on the other hand, is the actual disease, but without teeth, so de-weaponized. And then you have your recombinant vaccines. Those are very new technologies, and there you actually input pieces or fragments of the virus or bacteria sometimes, and allow the body to build that protein. And examples of that would be, for example, the melanoma vaccine that we have, and those are very therapeutic. Or, for example, for some people in the world that deal with rattlesnakes, the rattlesnake toxins. All right, briefly into each vaccine, just to give you guys an idea of how they actually work and why we do certain things when it comes to certain different types of vaccines. So your primary one, and a very, very common one, is your killed vaccine. And actually, one good example is lepto. Your lepto, you give the first dose, it causes your antibody levels to rise, but you have not reached your threshold yet to be immunized. You can also see based on the curve that it is quite short-lived and it starts coming back down. So you need to give a second dose. So that's prime. And then you give your second dose, it rises, and you're immunized usually 2 weeks after your second dose. Now, most people will then ask me, okay, so if the lepto requires 2 doses, what about the rabies? The rabies is the one we use a lot, and we always only give 1. So how does that work? And that's actually a very good question. So same graph. So you've primed. What happens now, though? You have not given a booster. Well, actually, your prime kind of stays relatively stable for quite a long time. And this is called the anamnestic response, where you have your prime that stays at a very certain level, but the exposure to disease catapults you into being immunized. So your exposure is in effect your second dose. And this is very, very true for rabies, which was shown in Kansas State, where they measured it in 8,100 dogs. They basically gave them a one-off rabies, measured their antibodies after 70 days. They were below the threshold of 0.5. Obviously, they did not give the dogs rabies afterwards to test them. But what they did is they gave them a second dose and found that they had a very steep and very fast response in antibody levels. And this indirectly demonstrated the antibody response versus a secondary response. So there is other things that your immune system can do. Moving on to modified lives. So modified lives are superior to killed. They will prime and immunize in one dose, as opposed to, for example, the lepto that we just spoke about, that a one-off will not do. Now, these are considered to give you optimum immunity in most cases. And I think the WSAVA and the AHA agree that in an adult mature dog, a one-off is enough to prime and immunize. If the dog is immature, then you wouldn't still need to give a booster. This doesn't apply to kennel cough, the intranasal one, which is a modified live, true, because it works on IgAs and not IgGs. So again, there are these specific nuances that change things a little bit. Downside to MLVs. So the downside to MLVs are that they are detected by maternal antibodies. So giving it too soon, or if you're not sure whether the puppy has, suckled properly and has maternally derived antibodies, your vaccine might be deactivated. The second thing is it can mimic infection because you are actually injecting the pathogen, just a weakened state. The third one, and this is where all of us can actually help and do something, is they are fragile to reconstitution and temperature. Once you reconstitute them, you can only use them in a certain frame. After that, also your temperature, your fridges, you need to make sure that you kept them properly. These are all things that are kind of the downsides to modified life, but things that aren't too difficult for us to control. Then you have your recombinant vaccine. So this is the sexy new tech that's out there, and I think all of us are going to have to get on board because most likely most vaccines are going to start using this kind of technology. People are not going to like me saying this, but they don't actually immunize in the strict sense of the word. They're more of a delivery system. So if you remember before, you're basically giving the recipe of the protein to the body, and the body starts manufacturing this protein. And that protein is then what stimulates your immune system. So it's basically the dog is immunizing himself. Now, plus side, they cannot be detected by maternal antibodies, so you can start your dogs much, much younger. They also provide optimum immunity in most cases, and these will give you the humoral and cell-mediated immunity. And the humoral one, if everyone remembers, is prevention of disease, and the cell-mediated is the recovery from infection. They also don't contain adjuvants, and this is a big thing because in cats, and I think in the near future, we're going to see that we're going to have to stop using certain vaccines or try to avoid using them in cats, is that the adjuvants were shown to be linked to injection site sarcomas. So, for example, cats who are particularly sensitive, eventually in the future, we can actually minimize that as well by using recombinant vaccines. Now, there's different types of recombinant vaccines. You have vectored recombinant vaccines, like in canine distemper, which use the canary pox vector, and they don't have any adjuvants. And you have recombinant subunit vaccines. That would be your FELV vaccines or your canine Lyme's disease. So you are already inadvertently using some of these without necessarily knowing the technology behind them. Overall, they're considered much safer, which is also why I think that in the future we will be moving slowly towards using recombinant vaccines. Now, how long do these vaccines actually last is a question we get all the time, and it's a very difficult question to answer because you have the medical answer and then you have your legal answer. Obviously, like in the UAE, we are mandated to vaccinate every year, and so we do, but so we do, but that doesn't preclude you from actually telling people that medically, yes, the vaccine does last longer. And actually, even when they tell you that it's a 3-year vaccine, most of these vaccines can last 4, 5, 6 years or longer. Interestingly, the only time that the validity of the vaccine really matters is when it comes to the rabies vaccine. So when they tell you that you have a 1-year rabies vaccine or a 3-year rabies vaccine, that is actually accurate, and you should try to stick to those timelines as much as possible. And an interesting thing I just noticed in practice is we always read the inserts, from that come in the boxes from the manufacturer. And Zoetis, so for their Vanguard, used to clearly say that the vaccine, the 5L4, is valid for 12 months. So we recommend revaccinating every 12 months. And actually recently, over the past year, if you look again, it will say, please check with your veterinarian when your vaccination is due. I think that is in part because they are also fully aware that a vaccine lasts longer than that. They're also aware that there are technologies out there, like a Vacci check, for example, that allows you to visualize this, and you no longer need to rely on the minimum. You can, if the law allows, you can actually start maximizing the things that you do. This brings our theory to a close. I promise. It's just to give you guys a bit of an update and a refresher. Immunity as a whole is much more complicated than just having your humoral and cellular immunity. It's an integrated part that actually comes together to give you that immunity, starting from the recognition, the rapid amplification of your memory B cells, elimination, and then regulation. So you want the response to be cut off at a certain point to prevent damage. All these parts need to come together to actually give you that immunity. So we've simplified it obviously today because I'm not an immunologist. So we simplify it to our humoral response and our cellular response, but there is so many more intricate parts, which unfortunately make this a lot more complicated than it ever used to be. So how is it that we keep missing the mark? With all this technology and all this knowledge, how is it possible that we still have dogs that test positive or that are vaccinated seemingly and succumb to disease? And that's where the titer test comes in. So the AHA guidelines very nicely published at least 12 reasons or 12 examples where the Vacci check could be used or is useful. I'm going to go through more or less 10 of them with you, just to give you an idea of how it works. But I mean, feel free to read the guidelines. They're very, very useful. But we'll start with your maternally derived antibodies. So this is a graph that we all remember seeing when we were at university and probably never looked at again, but it's actually surprisingly useful. So I'm going to use my laser pointer. You have your maternally derived antibodies, okay, in a very young, let's say, puppy, and they are protecting the dog and doing a very, very good job. And this lasts up until around 8 weeks. Now, the problem is that it's not the same for everyone. Okay, so some puppies may not have had milk over the runt, or their antibodies actually last longer or not as long. Now, the problem starts here where they are below the protective level, but still higher than the interfering level, i.e. vaccinating here, especially with MLVs, is not going to initiate the response that you are expecting when vaccinating a puppy. Now, if you had a dog that was assumed to not have been vaccinated or the vaccine didn't take, you vaccinate as a more or less mature pup and it shoots up and you have an active immune response. The light blue line, however, is when you start vaccinating your puppies at 8 weeks and you do a course of 3, for example, to get them protected. Now, looking closely, you can actually see that the difference here is minimal. So why do we even bother? Because when it comes to vaccinating puppies, it's a lot more about risk management than it is about speed to immunity. And that's what it boils down to. So this is a simplified curve where you just see the maternally derived antibodies. And this has been studied that at around 3 weeks of age, only about 50% of the vaccines will respond because the maternally derived antibodies will interfere or deactivate your vaccines. And again, remember that it's your MLVs that are mostly affected. So that's your parvo, your distemper, your herpes, calicium, panlu, which are actually your core ones, which are also the ones that you're looking out for mostly every year. If you consider that you have this graph, again, why would you bother with vaccinating a puppy at 8 weeks of age? Because sometimes you don't have a history. Keep in mind that when you have these graphs, you are in an ideal situation where you have all this information. But in the real world, you have a dog that comes in, you have no idea where he's been, not necessarily where he came from, or he's been through multiple owners. You know, the book has been lost. There is actually no vaccination history. You are then struggling to find out what to do. And the normal response would be vaccinate, 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 which is something that we used to do because that was the best to our knowledge. Now you can actually use a Vacci check to determine when are your maternal derived antibodies low enough for you to actually start your vaccination course. But what it can also do is at the end of your vaccine course, you can actually figure out if what you did was productive, if the dog is now protected and can go out and mingle and socialize and do all the things that a puppy and the owners want to do. So that gets rid of the first two on the list. Now, unknown vaccination histories also or mostly pertain to shelter medicine. Shelter medicine is much more complicated, and we're not really going to go into the details because it's a separate branch of veterinary medicine, if you ask me, especially compared to private practice. I can tell you, for example, that some shelters will vaccinate rabies at 8 weeks and not wait until 12 unless there's a legal reason, because they need that to kick in earlier. And if you remember, the rabies is a killed vaccine, so it does not interfere with maternally derived antibodies. It's one of those things. Outbreaks. So in the UAE, we are mandated to vaccinate every year, and yet every year we have cases of parvo and distemper. And actually, a few years ago, we had a few boarding facilities here that had multiple dogs come down with parvo simultaneously, and it required quick intervention. And it was an ideal time to use the Vacci check. So we went there and started drawing blood from every single one. And within, 23 minutes, we would know which category this dog fit into. Is he susceptible? Is he protected? Or, is he somewhere in between? Now, you can also use the Vacci check to find genetic non-responders. So if you remember, or at least it was like that for me, people always told me that Rottweilers and Dobermans were particularly susceptible or sensitive to parvo. And that is not untrue, but it is also very possible that they just didn't respond to the vaccine, which in part made them more susceptible to parvo. And it's true, there is a genetic flaw that causes them to have the inability to recognize epitopes on antigen-presenting cells, which does, in effect, contribute to making them more sensitive to parvo. Now, using the Vacci check will allow you to find those candidates because it doesn't only affect Dobermans and Rottweilers. And there's some stats for you there that actually non-responders to parvo are closer to 1 in 1,000 dogs. Distemper, I only managed to find data in the US, but I'm we can extrapolate from there. It's about 1 in 5,000, and for hepatitis, you're looking about 1 in 100,000. Working dogs. Working dogs, so if you have patients that are part of a military unit or police unit, vaccinating them can take them out of their rotation. They might need to recover. They might not feel so well the next day. You can use the Vacci check, for example, to help make sure that they are able to do the jobs that they need to do, especially if you know that they're quite sensitive to vaccines and things of the sort. This then takes us on to number 8, which is not to vaccinate every year. Again, this will be a question of legislation. We don't necessarily get to choose our legislation, but if you have the option, or you are in a country where you get to vaccinate, every 3 years or so, then using the Vacci check is ideal. You get to give yourself and your client that confidence to know that the dog is protected and that what you're doing is correct. I mean, personally, I would try and make the Vacci check equivocal to the vaccines, because regulating, all these factors like temperature, storage, distribution of vaccines is very, very difficult. But if you make it equivocal, then, vet clinics can choose for themselves whether they would prefer to vaccinate or prefer to Vacci check, or like us, we do both. Comorbidities, another reason the Vacci check is very useful. There are situations where you simply do not want to vaccinate, and legislation will mandate you to vaccinate anyway. And this can be just a very old geriatric dog, but also, for example, Cushing's. We know that increased cortisol level will interfere with the vaccine, and they won't respond. We know that cats with chronic kidney disease have a lower immune response. We all heard about vaccines being potential triggers for IMHA. And diabetes, for example, so diabetes is not confirmed. We know that diabetics have a weakened immune system, or at least their immune system does not work the same way. There's a dysregulation. How that affects vaccines, we don't know. And that will require further research. It might be absolutely fine. There is also a bidirectional relationship, because we know, for example, that vaccines can artificially increase your blood sugar levels. So does that play a role? Yes or no? Remains to be seen. FIV positive cats, thank God for guidelines. There is a very, very good paper that literally gives you the guidelines for vaccinating immune compromised cats. One of them being cats that are FELV positive and some cats that are FIV positive. But again, do you want to use a certain type of vaccine for those cats? Do you want to vaccinate them at all? Dogs or cats that are on, cyclosporins or on chronic steroids, you can't really take them off it, or you don't want to take them off it, because what they're being treated for is pretty bad, and you don't get to build yourself that nice little window that they used to talk about to administer the vaccines. So all these things are things that we try to think about, and now with a Vacci check, you don't have to do these things anymore. The last one on my list is education on immunology. So, like I said before, we actually do both because we're mandated to vaccinate every year, but we still do a Vacci check. We do that because we want to learn about the risks. We also want to understand our individual patients and their response to vaccines, so we can be more efficient down the line. I'm going to also talk about other examples that I think are relevant to why we use the Vacci check. One of them being your environment. So shelters, we kind of spoke about, but breeders, you can implement a control for breeders to make sure that dogs have enough maternally derived antibodies to be protected. We here see a lot of imported dogs, so we can make sure that the vaccines were given properly at the point of origin. And then individuality. Is everyone's immune system the same? Not at all. So we can actually make sure that each dog is protected in themselves. Clinic management. As vets, you don't always get to choose which vaccine is purchased. Now, you then are forced to change the brand, and you're now no longer sure whether that also works, because yes, of course, it's possible that a dog responds to every single type of vaccine, but it's also possible that you come across a dog that really only likes one type, or that has allergic reactions to certain types of vaccines. Temperature control in practice, We're lucky because we're a blood bank. Our fridges, that is literally a photo of one of our fridges. They are rock solid because our blood products are stored there. So our vaccine fridge is set up the same way. So it really doesn't fluctuate very much and has temperature log and everything else. I don't expect everyone to go out and buy fancy fridges, but you can get thermometers that stay there. They also have an alarm. They also have temperature logging. These days, these things have become quite available. Now, this is going to be more specific to us here in the UAE, but I can tell you as a blood bank, the last mile of the cold chain is an absolute pain. It is so difficult to keep your product refrigerated, let alone frozen, for that last chunk of the journey. Our suppliers regularly in the summer will have to deliver these vaccines, at over 40 degrees. Now, you have to then rely on the fact that they are maintaining the cold chain, that the back of the van didn't blow a fuse and all these things. The changing of the brands, obviously, we've spoken about, but that is also something that might not even be the clinic's choice. There's often situations where, the brand that we want is currently out of stock. And then we have no choice because we still have to vaccinate regularly. And then all of a sudden you're dealing with a new scenario. Traveling dogs and legal requirements are always going to come into play for us, especially just because it's very cosmopolitan. We have people literally taking the dogs on holiday on a regular basis. They then get vaccinated abroad, then they come back. It's something that also changes in legislation. So they go somewhere where vaccines are not required every year. Then they come back here and it is required every year. These are all things that will influence your decision on whether you vaccinate, VacciCheck, or actually just, change the brand. Another interesting one is cytokine interference. So cytokines are basically what, let's call it, turn your immune system on, if you will. Now, very stressed out patients, let's say you have a dog that requires multiple people to handle it because it's aggressive or it's fearful. You have to wonder, is your vaccine going to have the same effect, or are you better off changing your approach? Is there a way that you can do it more fear-free? Do you do it at home? Things of the sort. And doing it at home, think about the last mile. You are now the last mile. You are taking the vaccine from your fridge in your car to their home. If you are not holding that vaccine at the right temperatures, you are now part of the problem for the vaccine. Now, we had a case I'll talk to you about. His name is George. I mean, this dog was hysterical, screaming if you even just looked at him. And I will go through the case with you later, but you will see that stress, in my opinion, definitely did play a role. Obviously, we can't prove it, but when I go through the case, I'll bring that up again. But the cytokine interference also brings me to these 2 points. Splitting vaccines. Splitting vaccines in your 1.5 kilo Chihuahua is something that we've been taught is beneficial, and I'm sure that it is. But even for us, and we only changed our regulations maybe a couple of months ago, is because your first vaccine will induce this cytokine cascade, you cannot administer the second vaccine within 10 to 14 days of the first one. We used to do it a week later, and turns out that we were also contributing to the problem. So it's something that is easy for us to do. So now when we split our vaccines, we literally ask them to come back 14 days later, and that allows me to be more certain that I'm not causing any interference and that my vaccine will actually do what I want it to do. Now, having said that, that does not preclude you from doing all your vaccines in the same day. Doing vaccines in the same day does not interfere one with the other. So that's absolutely still fine. Then another question I get a lot is, I vaccinated my dog came back 2 hours later, is all puffy, itchy, and basically had an allergic reaction to the vaccine. We then go straight for our steroids, which is very good. But do the steroids now interfere with the immune system and not allow your vaccine to do its job? The answer is no. You're absolutely fine to keep giving your steroids. It will not interfere with your vaccine at all. So in our clinic, we basically adopted the VacciCheck, and we do it every year and for everyone. We incorporated it into our annual package. We made it very, very affordable. So most of the time, we don't have any questions pertaining to why we want to do it. There is a triennial approach. So some countries where vaccines are allowed to be done every 3 years, we'll do the VacciCheck every 3rd year. That is absolutely fine. We chose for ourselves, based on the fact that we vaccinate every year, that we would just put that into the package and do it every year. We also make sure that any dog coming through the door gets at least one Vacci check, so we have a snapshot in time of what his immunity or her immunity was like, and we can then use that in the future or down the line should they choose to come back. Now, is taking blood from a dog difficult? We have gotten a lot better at it over the years. What we found works best for us is using an insulin needle in the back leg. A lot of the times we actually do it with the owner, so they're just sitting there, either on the floor, or we have one of those couches, or we basically lift them up and put them in air jail. We also don't shave. We literally just put alcohol there and go for it. We try to establish a stress-free environment. Again, we're luckier than most that because we're a blood bank, we have set up for a quite stress-free environment. But again, I'm sure that everyone can think of certain things that they can do to reduce the amount of stress, or using a chill protocol, or anything like that. When it then comes to reading the results, any score that is a 2, so the minimum score to pass or below, we have 2 independent people read it. So we don't tell each other what we think it is. And if both people agree, we will score that dog a 2. We also stopped giving half scores. So we don't do 3.5 or 2.5 or 4.5, because actually the number is kind of inconsequential. It's very much a pass-fail test. You either have immunity or you don't. So we always downscore, because that is the ethos of the test, is to know whether you are protected or you're not. Then where it gets complicated, and this happens to us a lot, is you have cases where you simply don't know what is going on, and it happens to us all the time. And we then take the entire vaccination book, and some of us sit together, like 2 or 3 of us, and we literally go through the entire history. We count days, we look at the dog itself, we try to figure out what may have happened or why it happened and what we are going to do next. Now, like with any test, especially in lab work, consistency is key. Stick to the same brand. If you figured out that your dog responds well to a brand, and you have the luxury of always having that brand available, don't change it. It just minimizes certain variables, and you end up only having to be worried about certain things. So that just makes it easier. We are lucky enough that we got a little robot that basically dunks the Vacci check for us. That also took out a lot of manual labor and got the alarm clocks on our phone also, which was very nice. But it also gave us consistency. So we were sure that instead of everyone doing exactly the same movement, exactly the same time, dunking it the same amount of times, things like that, is completely negated, which is great. Mixing the vial of your vaccine. I'm sure that lots of you, when you pick up your rabies out of the fridge, you have that white sediment at the bottom. Mix it thoroughly. Make sure that it's completely homogeneous. Same with the kennel cough. Every time I put in the diluent, I shake it for about a good 30 seconds, and there's still a bunch of powder at the bottom. Just make sure that is completely done. It's become such a reflex for us here that I actually sometimes see vets shake the diluent, and it's ridiculous, but that's absolutely fine. It just becomes a complete reflex. When you are actually running your Vacci check, we also make sure that we're mixing the blood into the first well thoroughly. So we literally aspirate, bring it up, and make sure that everywhere in the well we aspirate, the color is roughly the same, to make sure that your specimen has completely mixed into the first well. And that also started giving us way more consistent results, because sometimes we had dogs that would go up in score a year later. Sometimes we had dogs that would go from a 5 to 0, or there was wash at the back. There's tons of these little tips and tricks that you can use that will eventually just make your life easier. Now, how does it work in real life? Because I know that a lot of this is theoretical. I'm not sure how many of you have been using the Vacci check or have used it at all, or maybe you're using it all the time and you actually know all this stuff. But at least in the UAE, what I see a lot is some people will test most patients coming into their hospital for parvo, for example, or have a parvo test come up with a faint positive. And then I hear a lot that their dog suffered from a mild version of parvo. That's not completely accurate. Keeping in mind that this is not, and this is where we have to distinguish between what is an optimum immunity and what is a sterilizing immunity. Your MLV vaccine for parvo, I'm just going to assume that we're all using MLVs because it's just easier for the sake of this slide. It does not block the replication of the virus at 0. The virus still has to infect some cells to then, stimulate your immunity. They don't all get neutralized immediately, which means that some tests will even detect the antigen in the feces, and for about 3 to 10 days. But having a mild test come back positive does not necessarily mean that your dog had parvo. It could also be that there was an exposure, and it happened to be that at the time that you tested, you seem to have caught it. And that is also why at the beginning, when we split the vaccines into 2 categories, I was saying that an optimum immunity is not the same as a sterilizing immunity. Your sterilizing immunity would be killing it completely. And actually, distemper is probably the one that comes closest. So if you have a dog that survived distemper, again, it's not a guaranteed sterilizing immunity, but it's as close to a sterilizing immunity. So the chances of that dog reinfecting himself are slim to none, and the chances of this dog being symptomatic also very, very poor. Parvo, on the other hand, is near sterilizing, so it's pretty darn close, which is great. And rabies technically does provide it, because if you remember the anamnestic response, the exposure time is so long that you have time to neutralize the virus before you have any symptoms. So technically, that is a sterilizing immunity, because the virus will not have had time to establish itself and cause any kind of symptoms. Again, this is quite a deep rabbit hole, and the deeper you go, the more nuances you will find. But it's just to give you guys an idea of how intricate this actually all becomes, and why most of us, or especially me, needed to refresh a lot of our knowledge about immunology and vaccine usages. Because when people came in with ChatGPT questions, I needed to be able to give them an answer. But most importantly, I needed to know what I can do for my patients, of which one is George. Meet George. George is my super hysterical dog who will literally scream and shout just looking at him. Now, this is a brief vaccination history of George. So George literally got vaccinated every year, even started as a puppy. And you can see that the vets that did it were very, very diligent, and they kept the same brand every year, which is fantastic. So George got his last vaccine in October 2022. Let's say 6 months later, 5 months later, he came to see us. So you can imagine what we did. We Vacci checked him. And his score, you would assume, would be fantastic. It is not. George, interestingly, scored a 1 for parvo. So now the owner is very skeptical about the Vacci check. So what did we do? We ran a hemagglutination inhibition test. So we sent that off to Cornell. Cornell was kind enough to send us back the results. And lo and behold, George is positive for 1 in 80. Which is very odd, because 180 is what is required to score 3 on the Vacci check. So how does that work? Well, does it matter? Not really. The dog is protected. We're very happy. We'll see you in October for his annual boosters, because we have to do that. Comes back in October. Owner wished to repeat the Vacci check 1 more time. Same thing happens again. What do? We repeat the hemagglutination inhibition test. Interestingly, George is now down to a 1 in 20, still positive, but now he's slowly going down. So what do we do now? The first thing we thought of was change the brand. So we did. But because George gets so stressed out, we also advised the owner that we do it at home. We've actually checked him again about a month later, and look at that. The brand change and or doing it at home changed our Vacci check entirely. So what do we do when we have this very drastic change? We check it again. And look at that. George all of a sudden went to 1 in 1,280. So this boy is absolutely protected, and we're very, very happy. So we tell the owner everything is good. Do we know if it was the lack of stress or the brand change? No, we don't always get the luxury of perfect science in clinical practice, but it doesn't matter. We've achieved what we set out to do. A year later, he comes back for his annuals, and he's still holding perfectly. He's got a 444. But now it begs the question, what the hell happened? And was this absolutely necessary? God, no. Because we just changed the brand and he scored perfectly on the Vacci check. So it was not necessary. This was something that we were allowed to do by the owner, and allowed us to understand a lot about how all of this works. So it was just fortuitous and academic. But it also highlights the difference between what you're doing with a Vacci check and what you're doing when you run the gold standards for these tests. So for example, for parvo, it's the hemagglutination inhibition test. And it basically comes down to the fact that one measures the functional neutralizing antibody capabilities, and your Vacci check is just measuring your IgGs. So the next logical question would be, okay, but so if the Vacci check only measures the IgGs, how do I know how long it will last? And for George, for example, you saw he went from a 1 in 80 to a 1 in 20. That's actually a very good question. Technically, and this is where it gets, again, slightly complicated. Technically, if you had a dog, a mature dog, that has tested positive for antibodies for distemper, canine parvo, hepatitis, or feline parvo, it does suggest that they have built a memory immunity because of that anamnestic response that was so well demonstrated with the rabies vaccine. That also holds true for some of your core vaccines. The only caveat is that it doesn't apply the same for all. But it does mean that just because you score below the threshold on a Vacci check, it does not automatically mean that your dog is susceptible. This is what, and I'll give you the examples. Parvo, and this was the case for George. Low titers for parvo do not mean higher susceptibility to disease. The Vacci check can underestimate protection for parvo. When you have had a high score, that's the same thing with survivors or well-vaccinated dogs. There is a very strong immune memory, which means that when the virus or the dog gets exposed, he will have a very strong and rapid response, same as with the rabies, and still be protected. But you measuring it on that day at that time, the IgGs are measured below what is considered a safe threshold. Now, unfortunately for distemper, the antibodies matter a little bit more. If you have low titers for distemper, you are more likely to be susceptible to disease. And for hepatitis, most people don't really care about hepatitis because they don't really see it that often anymore. But for hepatitis, the low results are also important, less so than for parvo, but still important and still almost on the same vein as distemper. So if I had to make a traffic light system, I would say, your distemper, you have a low titer test, you need to do something about it. When you have hepatitis, it's a difficult one. We would still. So let's say you have a dog that scores brilliantly everywhere and it's just your hepatitis that doesn't function. We would still try to get those values to come up. For parvo, however, you need to be a little bit more careful because just scoring below the threshold does not mean that your dog is more susceptible to parvo. And then I would really recommend looking through the history of the dog and figuring out what it is you need to do, or running a hemagglutination inhibition test to see what the dog's immune system is actually doing. So this is a lot about antibodies, and this brings me on to the acronym PI, which is constantly reiterated by Dr. Ford, and it's actually very, very helpful. Having higher antibodies does not mean the same thing for everything. So, for example, like we mentioned before, for distemper, for parvo, for hepatitis, for feline parvo, you have high antibodies. It does mean you are protected, so that's wonderful. However, positive antibodies for lepto or FIV doesn't mean you're protected. It actually means they are infected. And then this is especially relevant for us here in the UAE, when they have a high titer for Ehrlichia or Anaplasma, all it tells you is that this dog was exposed to it, that it doesn't tell you any more than that, which is also why we run them in serials, because we need to see how it changes. So you're looking for a rising titer or it stays the same. Now, just to make things a little bit more complicated, the influenza virus for dogs, you can have positive antibodies and still be susceptible to disease. That's also why we see that some dogs get kennel cough even though they've been vaccinated. That brings me on to our last patient, who's a bit different from George. This is Raja. Now, Raja was bombed with vaccines in his first year of life. You can have a look here. So in 2021, he had 4. He had 5 vaccines. Then, as an adult, September 2022, so over a year of age, he received a Novivac again. You can guess what we did. We Vacci checked. And if I asked you what you think the score would be, I'm going to assume you think that it's going to fail because I'm doing a talk about Vacci checks. But actually, no. Raja scored perfectly. Everything was good. We're very thrilled. Comes back a year later. We do annual boosters here. We give the Novivac because it's mandated, but we also Vacci check on the same day. And then this happens. Raja now scores a 1 for hepatitis. Very odd. But keep in mind, we have vaccinated him on the same day, so the Vacci check we're measuring is the vaccine from the previous years. So what do we do now? We check it again. We love running Vacci checks here. So he came back on October 9th to measure the vaccine that we actually gave. And what did Raja do? Bounces back. Everything is hunky-dory. We're good. 1 year later, comes back again. This time, because we know he had that very strange sort of initial response, we did not vaccinate him that time, but we ran the Vacci check first. This is, again, educational, academic, if you will, to see what Raja is doing. Now we are low on both distemper and hepatitis. And if you remember, those are the two where a low titer is actually indicative of susceptibility. So we need to start paying attention. So that's what we do. Do we change the brand? Sure. He was very consistent. We use the same brands as well. So that's the first thing we did, same as with George. And we changed the brand to the Biocan Novel, which we gave 4 days later. And then we would assume, same as George, he bounces back up. He's a happy boy, should be no problem. But we are the ones that are skeptical this time. So we asked the owner to repeat the Vacci check. They did. And lo and behold, he's exactly where he needs to be. We're super happy. So we think it's all good. Because we're still skeptical, we asked them nicely if they would be willing to come back in 6 months just to see what the immune system is doing. And we ran it again. And it started going down, but still perfectly acceptable. So there was no reason for panic or to think anything was happening. Annual booster time. This is not that long ago, as you can see. Because we know we have a bit of a strange history, we Vacci checked again. And he's back down to a 2 for distemper. And distemper is not something that we can ignore. So now we have a pattern. We gave the owner the option of running the virus neutralization test, which is the equivalent of the HI for parvo, but for distemper, or we try a third brand. The owner said, let's do a third brand. We gave the Vanguard October 27th, and Vacci checked him literally like a couple of weeks ago, and he's back up to a normal level. This is just one of the cases that we see on a regular basis. And then my question to you would be, what would you guys do with this dog? There's not necessarily a right or wrong answer, but you have a pattern that has established itself. Is it absolute? No, in immunology, we don't get the luxury of absolutes. So if you take this case, and I can tell you that all of us here, we discuss Raja on a regular basis, and I can tell you that we will be discussing him just to see what it is we would do. But I will leave you with this, so you can use this as a practice and sit down with your colleagues and see what you guys come up with. I'd be interested to know. I'll leave you on this last note that vaccinating to obtain a higher antibody count for greater immunity is completely futile. Having a higher number on your Vacci check is pointless. It is a pass-fail test. It is black and white. You either are or you're not. And that is the absolute main thing that you want to focus on, because that is the only thing that matters when it comes to vaccinating. Thank you.
Thank you very, very much, Dorian. This was an amazing, fascinating presentation, really. We really enjoyed it on our end, and I learned some new things.
I'm glad.
And so again, thank you so much. And we'll see if anyone wants to respond to Dr. Dorian's question in the last slide, even now in the Q&A. So you guys can go ahead and kind of put in what your theories are. I will start with a couple of questions that we got. And again, and if anyone had any further questions, just put them in the Q&A box. So
hopefully I can answer them.
I'm sure you can. I think you were just too thorough. I don't think there are many questions left to ask here. We're getting a lot of compliments about how great the presentation was.
Thanks.
So I do have a question here, and that's more talking about the kind of practical side, about the pet owners. So
sure.
You usually get, or do you get sometimes pushback from pet owners? And if so, how do you deal with them?
We do absolutely get pushback. A lot of the times it's either needle aversion or they don't want to put their animal through unnecessary, let's call it pain. And then because we're in a country where we're mandated to vaccinate every year, we do still give people the option, and we then do just vaccinate if they're absolutely steadfast against it. But there are ways around it. Usually, if you use that insulin needle and you show it to the owner, it is so thin. Most people then realize that this is not so bad. Some dogs can be very dramatic, so we get the owner to help out. It gets them to feel quite involved. Usually tapping the back leg is it doesn't affect them whatsoever. And when the owner actually realizes that it's not so bad, it usually helps with compliance a lot.
Great. This question, I don't know if I fully understand the question, but the question is, if either immune or not, why not just rotate the brands?
Okay. That is a good question, and that would be something that would be viable to do, but you don't necessarily need to keep your immune system guessing. Also, when you rotate the brands, you might also be changing the technology. That will also dramatically affect how the vaccine works. If you are looking to, like I said, black and white, if you're looking to immunize your patient, your mission is to protect them, then you don't need to necessarily change the brand. You also want to avoid any, unnecessary allergic reactions or things like that. But yes, in the absence of knowing whether something works, same reason that we still vaccinate every year, it would not be totally unreasonable to change the brand and just keep the immune system guessing to potentially achieve the result that you're looking for. But my argument would then be, why would I need to guess? If I just draw, 0.2 ml of blood from a dog and run a Vacci check, it tells me that this brand works. But yes, in the absence of doing anything like that, you can absolutely keep the immune system guessing. I would then just ask you to really make sure you're using the same technology, just because you will be, eliciting different responses.
Yeah. There's a question here that you just kind of by mistake responded to, but I'll just make it clear. I will ask the question. And what is the minimum amount of blood sample do you take? Can 100 microliters be enough?
Absolutely. Honestly, sometimes we fail miserably at taking a blood sample. And we literally do it with less than that. And then the question becomes, is the EDTA in the tube affecting the ratio? So far, I have to tell you guys that we have not seen any issues with that. If it's a very minute amount, so you literally just, get a half drop, then no, we will try and get a more, decent sample. But we've standardized it that we try to get everyone to get 0.2, but I can tell you my colleagues are brilliant at hitting veins. Sometimes I think they do it with their eyes closed. And I tend to fail miserably. Yesterday I had a chow chow. I didn't know if it was a skin fold or a vein. Honestly, it took, what did my nurse say, 18 attempts? So it does happen, but as long as you get something that is more or less representative, like a good solid drop, which is about 100 microliters, you should be absolutely fine.
Great. James had asked the previous question about rotating brands, so he also was asking if rotating might be less expensive. Oh, than titer testing, if I understand correctly.
Good question. The honest answer is I don't know, because we made sure, and obviously I have the luxury of being the medical director, so I have, a little bit of influence on pricing, even though my manager overrules me on a regular basis. We tried to do it that way so we didn't have that issue, but yes, if it ends up being cheaper and you have no way of vaccine checking, so I mean, like, you have absolutely no idea if any of them worked, and the dog doesn't seem to have any allergic reactions, you could possibly rotate your vaccine brands and try to get a more statistically significant response. It's a difficult question because you are having a lot of guesswork. There's a lot of variables left open, but yes, if it is significantly cheaper, then you could do that. Just be aware that at some point you're going to choose a brand and the dog might not be so happy about it and come back with, a blown up face or super itchy or something along those lines.
Yeah. Okay. Do you find EDTA sample better than serum or plasma?
Good question. Again, I'm very fortunate. I'm in a blood bank. I have my blood bank manager who is, I think the correct term is anally retentive about sampling, which means that we're all on high alert every time. When we have samples that just don't seem to correlate, and again, we look at the picture as a whole. So let's say we constantly get a background on the test, or the results are just widely variable, then yes, sometimes what we will do is we'll run the serum as a comparison, and that will help us determine whether or not what we're looking at is the real deal. It just gives you another avenue. We see it more as an added bonus that helps us determine if what we're doing is correct or if it is just the dog.
All right, so here, a bit of a long question. Let's see. Would you have a written protocol of what your optimal vaccine schedule would be if not mandated by the government from 8 weeks of age and above, keeping in mind your experience with VacciCheck and patterns you've noticed?
Yes, absolutely. We play around with this idea on a regular basis, and I'm more than happy to share it with anyone. If you guys want to send an email, I can send it to you. We toy with this idea on a regular basis. I can tell you that when we all get together, that changes. That's changed, I think, at least 3 times that I can remember, because we rarely agree with each other. But I'll be honest, the guidelines from the WSAVA and the AHA are really very excellent, and I think from our last meeting that we had together was the defining sort of entity in how we would run our optimal protocol. And the wording in both guidelines can sometimes be a little bit heavy and difficult to understand, but they do tend to agree with each other on most things, which is nice, because as we all know in veterinary medicine, we rarely agree with each other, let alone in studies. But I'm more than happy to share that with anyone. I can also share the links for both guidelines. They're available for free online, and they're definitely worth a read.
I would like to add to that a question of my own, just from your experience. Do you sometimes get dogs that you do not know what their immune history is at all, or you know they have not been vaccinated for years, and what do you usually see when you're titer testing these dogs?
Also, that's actually a really good question. It does happen to us a lot. We have a lot of pets that are either adopted, and like I said, the books went missing, or they've been adopted from a shelter, and then you have zero history. You also don't know if the pup was with the mother, because there is also dogs that are stray dogs, so it would be almost impossible to know. And we absolutely vaccine check them, and then it is a complete guessing game. Every time I try to predict, I am wrong more often than I'm right, because I look at a dog and think there's no way this dog is going to pass. And I mean, those dots come in black as black. And you're just like, wow, okay, so this dog is so heavily protected, and it's a wonderful feeling. It's one of those times you're happy to be wrong. And then, you have cases like George, who comes in rock solid, and literally I actually tell people at the appointment, don't worry about it, your vaccine check will be fine. I've looked at your book, he's been vaccinated properly, like everything is good. And then I have that phone call to make a few hours later going, hey, so listen, we're going to have to get you back in here and figure out what's going on, because apparently it's not at all what I thought it was.
Right. I would love to add to that I do also strongly believe titer testing is taking the guesswork out of vaccination. So it's something that goes together with vaccination protocols, or of course, you're not going to get positive titers if the dog is not vaccinated. So they really do go hand in hand, but it's taking all the guesswork out of it. It's like Dr. Dorian said, 9 out of 10 times he guessed wrong.
Yeah, honestly, yeah. And then
not guess.
Yeah, and then again, you have a bunch of dogs that are having symptoms. You can quickly rule in or rule out who's actually going to be at risk and who's not. So it extends so far further than just your regular vaccine appointment. I just try to tailor today's talk on the vaccine appointments, because most of us, that's what we do day in, day out, and we do a lot of them a day. And it just helps us understand how these things work. And nowadays, I think dogs, last time I checked, there's over 120 vaccines available for dogs. I'm only aware of about 10 of them. But I can tell you there's over 120 out there. So the guesswork is absolutely correct. Yes.
Yes. All right. So we do have another theoretical question.
Sure.
And do you see the Vacci being used in screening puppies if they still have maternal antibodies prior primary vaccinations? Well, I wouldn't say it's theoretical. It could be reality.
Absolutely. Yep. I think breeders should start doing the vaccine check if we can get them to take blood, or else bring a vet in to draw the blood. If you could actually demonstrate that the puppy's MDAs are still there, vaccinating them kind of becomes pointless. Not entirely, but kind of. So yes, absolutely, it would be very, very worthwhile using vaccine check again if it is affordable to you to do that, to know when you want to start this puppy. We don't get that privilege very often because obviously we spay and neuter a lot of our dogs here, so that doesn't happen. We more often use it at the end to see that A, we actually did our job, B, that the puppy did his job, because it's a combination. Because if his immune system has decided to be busy with something else, then we need to know about it, and then we can actually be more proactive rather than reactive. We should see a significant decrease in cases of parvo and distemper. I truly expect us to see a statistical significant decrease in the epidemiology of this disease.
All right, let's try to go for a couple more questions.
Sure.
But we're almost done.
That's fine.
So how do you think about population medicine versus individual medicine?
Population medicine as in being more around like shelter medicine, or are we talking about herd immunity?
That's a good question. I thought it was more about herd immunity, but now that you brought up the other option, you might be right.
I mean, we can talk about both.
Respond to that if you want to respond to us exactly what you meant, and then let's go to the next question meanwhile. Done. All right, this is a good question. When did you realize to incorporate VacciCheck with your annual vaccination program? What convinced you to start doing this approach?
I'll be honest with you, it was my colleague. My colleague came to me one day and said, "We need to start doing this." I had no idea what she was talking about. And she gave me a steadfast lecture about antibody titer testing. And we started looking into it more and more, and it became more and more obvious to us that this is absolutely something that we need to integrate. After that, finding a way to integrate it in your protocols was actually the easy part. We at the beginning, I'll be honest, we constantly had theories, and we tried things, and we failed, and we tried other things, but it was actually my colleague that brought this to my attention, and I have to say, like, we haven't looked back. So I can't take credit for that one, I'm afraid.
Well, that's how it works.
It does.
How it works. And all right. So I don't see. Oh, there we go. James answers. Studies that looked at population while individuals may be different than the results of the study. I don't fully understand the question. I think what he meant was that what we know about titer testing is studies that have been done, and there have been a lot of studies done about titer testing, was looking at a population of dogs. And I don't fully understand. Maybe Dr. Dorian, you understand the question?
I think I do. So this is the cases where they're actually measuring it on a whole versus the individual dog. Yes, there have been studies, and also the vaccine check is not perfect. No test is. And yes, there is going to be discrepancies out there, but that's also why there are so many more things around immunology and vaccines. The vaccine check is just another tool in your arsenal. You have to look at the environment, you have to look at the breed, you have to look at the genetics, you have to look at the immune system of that particular dog, you have to look at the physical vaccine, you have to look at how it's manufactured, because again, they do that differently. If you look at all those things as a whole, and no study can, I would say that if you actually critically analyze a lot of these studies, you would find that there are limitations. And I think those limitations can be quite powerful. I don't negate the data. I think the data is there and should be used and should be incorporated. But I also think that looking at the limitations of these studies is absolutely vital when, extrapolating data.
Yeah, I think that's an excellent point to bring up, that everything that we do as veterinarians in veterinary medicine, we always have to look at the whole clinical picture. We're never going to take just one part of the puzzle individually. And yeah, that's a great point. And that's a great question.
Yeah, it is. It's a very pertinent question. It's a very, very difficult one to answer. And I'll be honest, we've also read papers at the beginning that seem to say that you don't really need to do it. You do need to do it, but it's different for this. And actually, if you look at it as a whole, it makes no difference. Sure. Again, we are working on an individual basis. Like I like to tell people, we are in the trenches. You are the first line. If you have luxury of studying epidemiology and looking at it as a whole, that is a totally different perspective and a wonderful perspective to have, and probably very pertinent if there is standardizations. But again, these are two completely different perspectives, and you have what is correct for one perspective might not be correct for the other perspective.
Absolutely. All right. Thank you again, Dr. Dorian. It really was great and interesting and fun. I would also like to thank again our partners at Eurovet. And so we have listeners from all over the world. So for those of you that joined us from UAE, if you do want more information about VacciCheck, please contact Eurovet. And for all the other viewers in all the different other countries, if you also would like information about VacciCheck, please contact BioGal at info@biogal.com. And again, it was a pleasure. This webinar has also been recorded, so we will send out anyone who registered, even anyone who listened today and wants to rewatch or miss some parts, you will get an email from us with a link to rewatch it as many times as you want. And thank you again. Really, thank you so much.
It was an absolute pleasure. Thank you.
Bye.